Have you ever heard someone say that knee pain is just part of getting old? Or maybe you've even thought to yourself, oh, it's normal, I'm just getting older. But what if I told you that not all knee pain is simply normal for your age and something you just have to accept? Today I want to help you understand this better. There are some clear signals your body might be sending you, indicating that your knee pain needs special attention, a professional's eye. And look, if you've ever felt or currently feel a little knee pain and wondered if it was serious or not, go ahead and hit that like button on this video and subscribe to the channel. That way you won't miss our next tips that can help you live with more comforts and independence. So, let's dive into the 5 signs that your knee pain is not normal for your age. The first sign we need to pay close attention to is pain that doesn't go away even at rest. You know that pain that stays with you all day, even when you're sitting on the couch reading a book or lying in bed trying to sleep? If the pain in your knee persists, even when you're not making any effort, when you're completely at rest, that's a red flag. Normal age-related wear and tear pain usually gets a little better when we rest. If yours doesn't improve, it's a sign that something more might be going on and needs to be investigated. The second important sign is swelling, redness, or warmth in the knee area. Imagine you're looking at your knee and you notice it's bigger than the other, or the skin looks redder, or even feels warm to the touch. These are clear signs of inflammation. Inflammation can be caused by various things, from an injury to a condition like arthritis, and certainly it's not something we should ignore, thinking it's just due to age. A swollen, warm knee is asking for help. The third point of concern is difficulty fully bending or straightening your knee. Do you try to straighten your leg and feel like it won't go all the way, or try to bend it and it feels like something is blocking it? This limitation of movement, which prevents you from performing the full range of motion in your knee, is a sign that something might be hindering the proper functioning of the joint. It could be a problem with cartilage, menisci, or even fluid buildup. If you notice that your knee no longer has the same freedom it once did, it's time to seek help. The fourth sign that deserves your attention is the sensation that your knee is giving way or locking up. You know that strange feeling that your knee is going to fail you, that it can't bear weight, or that it suddenly locks as if it's going to pop out of place? This is very dangerous because it can lead to falls and other injuries. This instability is not normal for your age. It can indicate problems with ligaments, the patella, kneecap, or other structures that provide stability to the knee. Don't ignore this feeling. It's an important warning from your body. And the fifth and final sign I want to highlight is pain that prevents you from doing simple daily activities. If knee pain is stopping you from going up and down stairs, walking to the grocery store, tending your garden, playing with your grandchildren, or even getting up from a chair without strong discomfort, then that pain is not normal. We deserve to have a good quality of life at any age. If pain is stealing your independence and your joy in doing the things you love, it needs to be treated. Perhaps you're thinking, but I feel a little pain now and then. Could it be one of these signs? The truth is, what's important is to observe the intensity, frequency, and how this pain affects your life. It's not about panicking with every little ache, but rather about paying attention to the signals your body gives you. Most importantly, you don't have to accept pain as your destiny. Medicine and physical therapy have advanced greatly, and there are many ways to relieve pain, improve mobility, and give you a better quality of life. Don't settle for discomfort. If you identified with one or more of these signs, the first step is to talk to a doctor. They are the right person to evaluate your case, order necessary tests, and recommend the best treatment. It could be physical therapy, specific exercises, medication, or other approaches. The important thing is to seek help and not let pain limit you. Remember, taking care of yourself is an act of self-love. Don't let knee pain stop you from living fully. Small actions and seeking professional help can make a huge difference in your life. If this video helped you better understand your body's signals, please share it with a family member or friend who might also be going through this. And tell me in the comments, which of these signs have you noticed, or which will you pay more attention to from now on? Your experience can help others. A warm hug, and see you next time.